Bismillahirrahmanirrahim. This is Dr. GHufran Babar, and you're watching my YouTube channel. Today's information video will be on excessive crying in babies or fussiness in babies, and we'll also talk about infantile colic. This is an informational video, and it's not superior to a physical exam by your physician. So this was my disclaimer. So excessive crying and being fussy in first few weeks of life, in first few months of life is very common and is a source of concern for parents, for physicians, because you don't want to miss anything serious from a physician perspective. And from parental perspective, excessive crying or fussiness in a baby leads to anxiety, lack of sleepiness, and concern that their child is seriously sick. And it is one of the most common complaints for which a child is brought during first few months of life is excessive crying, inconsolability. And prevalence is up to 40%, 1.5 to 40% of physician visits could be because of excessive crying. United Kingdom's study indicates that up to $108 million are spent on babies' workup, exam because of their excessive crying and fussiness. So that in turn tells you the magnitude of the problem. It is a clinical challenge for a physician, although it's annoyance and difficult for parents to see their child crying, but definitely fear of missing a diagnosis, as well as avoiding unnecessary medical workup or tests is another ethical and medical concern. And the way the child communicates with their parents is by crying. So crying is their language. When the crying becomes excessive and parents have not been able to figure out why their baby is crying, that is when they want to consult their physician. It is associated with anxiety and stress in mom because of lack of sleep. And if they see that the child is inconsolable, they think that they are not doing something right. Maternal depression can result. It can affect maternal breastfeeding. Moms are not able to feed their children well because stress causes decreased production of milk. It causes stress in relationships between husband and wife, other family members, and mother and infant. Increased chance of child or infant abuse can occur because of the excessive crying in the baby. The fathers and mother-father relationship is affected because if dad is not giving due time to the baby and mom is stressed out, physically and mentally exhausted, then it can strain the relationships, and that can lead to physical violence within the family, and violence, of course, towards the baby. Mom's boyfriend is another example. Mom leaves excessively fussy or crying baby with her boyfriend can lead to abuse as well. So that tells us that this is a very, very, very serious topic in the child's healthcare. And usually there was a study done in 1962 in which they studied babies up to 12 weeks of life. Brazelton in 1962, he found that up to second week of life, the babies can cry up to 2 hours per day. And at 6 weeks, it could be as much as 3 hours, close to that. And after 6 weeks of life, the excessive crying gradually declines. And there appears to be circadian rhythm, meaning with the fall of sun, there is excessive crying late afternoon and evening. And of course, that is the time when parents are tired and they want to go to bed. So Lingworth in 1954, he described about 50 infants more than 3 months and less than 3 months, and they said that there is rhythmic attacks of screaming, excessive crying without an obvious reason, and which was later labeled as 3 months colic because these babies were under 3 months. And there are other people who have called it paroxysmal fussing. And amount of crying which is excessive, which is accepted by Vessel's studies, he was a pediatrician, is more than 3 hours. So if more than 3 hours crying per day, sometimes continuously, that is really, really excessive. So importance of this time is that we should not miss anything serious or any illness which could be life-threatening. And then we have to find out what could be a treatable cause to prevent morbidity and mortality. In one of the studies, 200 crying infants who presented to the ER, they had 3 common diagnoses. And this study was done by Fahimi in the ER. Up to 30% had simple colic with excessive crying with no obvious reason, ear infection in up to 16%, and constipation in up to 5 to 6%. Other non-pathologic causes which were noted were child may be hungry, thirsty, tired, lack of sleep, or lack of right environment to sleep. It may be very loud around the baby and the baby cannot sleep. Or some other caregiver is taking care of the baby and the baby is not sense the maternal smell. There is a new babysitter or a family member who has volunteered to help a mom, or mom is going back to work and someone else is taking care of the baby, and that leads to excessive crying. Sometimes excessively low temperatures in the environment or high temperatures. Baby may be cold, may be too hot. There is no electricity or there is no proper air conditioning. That can also cause the baby to become fussy and crying excessively. Or the baby has pooped or passed stools and someone has to clean the baby, and that could cause excessive crying as well. And in most illnesses of the babies, which are neonates and infants, irritability and inconsolability is one of their major symptoms. And for a pediatrician to decide, or for a parent to decide when to take the child to the physician when the child is inconsolable, crying excessively, is very, very, very difficult. So, for a physician, they have to take a detailed history, a good clinical exam, and then followed by relevant investigation would be nice. And most importantly, parental concern is very important. And the first pediatric book that I read was the caption on the first page was that mom is always right. So maternal concerns should never be undervalued by the physician. If mom is concerned about their child, a physician has to take it seriously and do a detailed exam of the baby. And the physician should also look at the clinical cues that can help in diagnosis of the child. The child is not moving any extremity, is pulling on the ear, breathing fast, not responsive, vomiting, any rash present. So those things are important because they will help us in identifying the cause. So physical exam can help in 40% of the diagnoses. So it's very, very important to take maternal or parental concern, very important. So when a mom is worried about a child being excessively dry, inconsolable, fussy, and you see that it is more than 3 hours per day which is going on, make sure when the child comes in, check the temperature, respiratory rate, check the oxygen saturation, the vital signs, blood pressure. So all those things have to taken into consideration, making sure we don't miss anything. Then head to toe exam, making sure the anterior fontanelle, which is the soft spot on the top of the front of the head, is not bulging. Usually it should be slightly concave, and if it's bulging out and the baby is crying, sometimes it can be bulging as well. So if the child stops crying in between, then see if that bulge is still very prominent, because that can indicate meningitis. Scalp veins, if they're very important, the sutures are separated, could be increased intracranial pressure because of hydrocephalus. Ears have to be examined, making sure there's no ear infection, foreign body in the ear, or there's any drainage from the ear. Nose blockage is a very common cause because children are obligate nose breathers when they are breastfeeding or taking bottle. So if they have excessive nasal secretions, or if their nose is blocked, they will not be taking feed, and feeding is very important because this is a time of rapid growth for children. So they will be excessively fussy because obviously they cannot breathe while feeding. So the priority is breathing, so they stop feeding and start crying. Then looking into the eye is very important because sometimes babies have longish nails, parents forget to cut them, and they can scratch a cornea, or there could be blockage in the increase in intraocular pressure. Glaucoma can present with excessive crying, so cornea would be bulging, or eyes could be red because of the corneal scratch, and child will have blepharospasm. The eye would be closed, they will not be opening the eye, and there would be excessive drainage and redness in the eye. Throat, they could have painful sores in the mouth because of herp angina, which causes sores at the back of the throat. There could be thrush in the mouth, which is causing these difficulty in swallowing for the baby. Then any obvious swellings in the neck, look at that. Is there any tender lymph node? Is there any drainage from anywhere, which could be the cause? Sores on the mouth, lip area, they have to be examined. Respiratory status, respiratory rate, oxygen saturation, and then work of breathing. How fast the child is breathing. Is the child is using the muscles, intercostal, subcostal retractions are present. Is there any abnormal sound like wheezing, crackles, or there is a stridor, which is upper airway obstruction. So upper airway obstruction usually presents with stridor, while lower airway obstruction could present with wheezing, and bronchiolitis, crackles could be present with nasal drainage. Abdomen, if there is a mass palpable, could be pyloric stenosis, in which kids after age 2 weeks can present with profound vomiting. Or there could be intussusception, which is basically telescoping of the intestines. When one part of the intestine it goes into the next part, and that causes telescoping, and obstruction, which will lead to excessive colic, excessive fussiness, excessive abdominal pain with vomiting, could have red currant jelly stools, and could be diagnosed by the ultrasound. You go down, you look at the testicles, making sure there's no swelling, no torsion, inguinal canals, there's no hernia. Sometimes hernia could be obstructed, and hernia is basically a part of bowel. It goes into inguinal canal, which is basically a pathway for the testes to descend into the scrotum, because developmentally they're close to kidneys and they come out. Sometimes that path, that inguinal canal, is patent and fluid or bowel can come out, or the testes could be they could have torsion, meaning their blood supply can stop because of the coiling, excessive movement of the testicle or the blood vessels, which can lead to profound pain, excessive pain, and those things should not be missed. Look at the joints, extremities, making sure there is no deformity, there are no bruising, there is no swelling, redness, painful joints, since they could be present in septic arthritis or infection of the joint, or if there is a deformity, could be because of the child abuse, fracture. Look for any paralysis, not moving their extremities, which could be in vitamin C deficiency like scurvy, or if there are microfractures in rickets, anything could be there. And look at the child's behavior, whether the child is looking toxic, really febrile, sick looking, mottling of the skin, any recent or current seizures, any local or focal signs for brain disease. And then you have to look at the genital area, any redness, drainage from the genital area, signs of trauma in the genital area, discharge, adhesions in the area in female babies, or there could be foul smelling urine as reported by mom. So those things are the hard signs that should not be missed. So the summary of causes, you have to make sure you don't miss trauma in the baby, corneal abrasion, or glaucoma, which is increased pressure in the brain. Sometimes they could have infection in the fat, which is paniculitis, that should not be missed. Upper airway obstruction by foreign body, abnormal breathing sounds, ear infection, of course, and pneumonia. If the baby is able to tolerate feeds, there could be, you worry about is not able to tolerate feeds because of excessive breathing, nasal obstruction, aspiration pneumonia, or pneumothorax, in which because of excessive coughing, the child may blow up air in the chest, leading to respiratory compromise. And those things you have to investigate by appropriate tests. Heart itself, those kids who have congenital heart disease known, or sometimes like VSD, which was not picked up, and they present with congestive cardiac failure. The child tires, gets very tired during feeding, with sweating on the face, excessive fussiness. Those are signs of impending heart failure due to a ventricular septal defect or a hole in the ventricular septum. Abnormal heart rhythms like supraventricular tachycardia, in which suddenly the heart rate goes above 220 in an infant, you have to be very, very cautious about it. And fevers can trigger that as well. Signs of other illnesses like endocarditis, myocarditis, which are rare, can be there. And if there is a compromise of the blood supply, in stenosis of the coronary arteries, they could have myocardial ischemia, and that can trigger profound cardiac pain. So GI causes which are less benign, like evening colic, there could be gastroenteritis, dysentery, blood, and the serious causes like intussusception, where bowel of the intestine goes into the next bowel, which is telescoping, leads to obstruction. Volvulus, where the bowel rotates on itself, stopping its blood supply like a coiled intestine, which can lead to obstruction. Appendicitis, although is rare in the infanthood, but that is again one of those things that are missed. Constipation is a very, very, very common thing in babies, and if it is profound, it has obstructed the intestines, they are not able to pass stools. They can also lead to excessive fussiness. Sometimes upper gastroesophageal reflux disease can cause acidic contacts going into the esophagus, causing sandy fair syndrome, in which there could be arching of the back because of the acidic contents of stomach going into the esophagus, causing excessive pain. Esophagitis can occur. Due to excessive constipation going down again, they could have anal fissures, and they can present with blood in the stool. That is very, very, very common. And sometimes they could even develop excessive engorgement of veins because of the excessive constipation. Milk protein allergy is another important thing. Inguinal hernia, like I said earlier, it is coming out of that inguinal canal and it gets obstructed, can lead to strangulated hernia. Testicular torsion we discussed. Retention of the urine because of the posterior urethral valves can lead to excessive crying and fussiness. The baby is not able to pass urine because of outflow obstruction in the urethra because of those valves. And urinary tract infection, of course, that will be associated with fever most of the times. And local infection of the prepuce, like balanitis, balanopostitis, can also cause the excessive fussiness. And we discussed the joints and the bones. So septic arthritis, fracture in bones, or in anemia like sickle cell anemia, they could have sickle cell crisis, dactylitis, pain in the fingers, like a vaso-occlusive crisis can take place. Brain, we already discussed that they could have infection, which could be meningitis or encephalitis, obstruction in the flow of CSF, cerebrospinal fluid, which is around the brain, which can lead to obstructive hydrocephalus. Sometimes neonatal drug withdrawal. Mom was a heroin addict, or mom received methadone because of that, can cause excessive crying. Endocrine thyrotoxicosis or neonatal thyroid disease in the baby can cause excessive fussiness, excessive crying, increase in heart rate. So those are things are important. Hydrocephalus itself could be caused by a brain tumor, or they could be just because of increased CSF pressure, like pseudotumor cerebri. Make sure you expose the child completely, because sometimes babies are at risk for abuse. They could have burn marks on their bottom because of the scalding water in which the children are immersed. They could have rashes, bruises, or signs of infection. Could be a big insect bite on the bottom, or a scorpion or insect bite which is infected, a spider bite. Those are the important things. Or baby has rashes, excessive rashes, like atopic dermatitis, mastocytosis, in which the child will be excessively irritable, uncomfortable. Drug toxicities, overdose, like vitamin A, can lead to pseudotumor cerebri. After vaccination, the babies would be fussy. The mom will be bringing the child in a couple of days after, or one day. They can have fever, they can have pain in the injection site, they could be really, really, really crying. There could be infection where the child received vaccines. And of course, neurological brain hemorrhage, shaken baby syndrome, where you have some parents start shaking the child violently, leading to hemorrhage in the brain and excessive fussiness. So it is important that the child should be assessed in detail, and do not just disregard that it could be a minor thing. Hair tourniquet, which I was about to miss, is that a hair of mom can tie around child's fingers, sometimes around the penis in boys, around the toes. So detailed exam of extremities is very, very, very important. So if you don't find anything, child is not febrile, consolable, relax, it's important that the child should have a follow-up within 24 hours. Do not over medicate for no reason. You do not prescribe antibiotic for no reason. If you don't find a cause, then do not just label the child, oh, the child has an ear infection, without knowing it clearly. So in underdeveloped worlds, it's very, very common to prescribe antibiotics without knowing the cause of child's illness. Reassurance, if you don't find any cause, the child looks otherwise healthy, consolable, well hydrated, afebrile, normal breathing, normal abdominal and extremity, genital exam, neurological, reassurance. It could be just a simple colic. But do not just jump on it that, oh, it could be just colic from the get-go. So colic is usually excessive crying greater than 3 hours per day, occurring greater than 3 days in any week for 3 weeks. So it is not just one day crying. So they have been crying for 3 hours, more than 3 days per week, and for greater than 3 weeks. In otherwise, a healthy child, aged 2 weeks to 4 months, you should entertain the diagnosis of infantile colic. And it is estimated that it affects about 10 to 30% of infants worldwide. So 1/3 of the babies that come to a pediatrician because of excessive crying could be just simple colic. So it could be because of cow milk protein allergy or intolerance, reflux disease, feeding difficulties. Mom is a new mom, does not know how to breastfeed, and child is hungry. Child is not able to sleep well because one reason or the other, or child has developmental delays. Baby and mother interactions are not good, lack of infant-parent bonding. So if the child looks well, is consolable, do not order expensive workup. And the physician has to be very astute, very careful in head-to-toe exam. And if you don't find anything, the child vital signs are stable and the child doesn't look sick, reassurance is advisable. And sometimes first visit you may miss something, and the child returns in 24 hours and now with fever, so has a UTI or urinary tract infection. So toxic appearing baby with unstable vitals within first 1 to 2 months has to have first month usually guidelines are you have to do blood work, including the blood culture, CBC, CRP, urine analysis, urine culture, and of course a CSF exam in which you will get the cerebrospinal fluid from the lower lumbar L1, L2 area, upper lumbar area, and then you have to send it for exam. And L2, L3 is also could be anywhere between that area, and then you have to send for exam and send for culture, both viral and bacterial, because herpes encephalitis is very common, as well as bacterial meningitis, and the causes are diverse and needs a specific whole video on that. So if there's no obvious cause, like I said, you have to make sure you follow up in 24 hours, or if they are too far from your location, the parents are worried, they are not satisfied, they are worried, you may want to admit the child for observation. If you notice any social concern, poor support at home, unsafe environment, social worker has to be involved. And if you see any signs of abuse or neglect, social worker, psych consult, scan, which is basically consult to make sure that there is no child abuse, and child protective agencies could be involved. However, clinically stable, normal child, you can send the child home, and with no social concerns, immediate follow-up available. You can tell parents develops fever greater than 100.4 degree Fahrenheit, the child becomes lethargic, unresponsive, has a seizure, is not tolerating feeds, no wet diaper in 8 hours, is not pooping for several days with vomiting. So the child should be reassessed. So the myths, the baby doesn't have fever, is not sick, is wrong. The child could still be septic without fever. So that's sometimes hypothermia could be sign of sepsis in children. Heart rate elevation, make sure you don't miss supraventricular tachycardia. Don't miss non-accidental trauma, which is child abuse, because it's very, very, very common. Don't just think that the parents are well appearing, that they look fine as a family. There could not be any child abuse. History and physical exam is the cornerstone of assessment of excessively crying baby or a fussy baby. And labs are not needed if the child is stable, vital signs are stable, temperature, respiratory rate, heart rate, blood pressure, oxygen saturation, they are normal. Then you can still observe or send the child home, and you can call them for any worsening of symptoms. So in summary, infections are most important, that should not be missed. Non-accidental trauma should not be missed. Heart failure is important, not to be missed. Child may present with fussiness. Commoner causes other reflux, gastroesophageal reflux disease, formula intolerance, or reaction to medications, immunizations, insect bites or spider bites could be there. Do not miss the abrasion of the eye or increase intraocular pressure, hair tourniquet around the fingers, in which a hair can form a tight noose and leads to ischemia of the fingers or toes. And of course, the big thing for the surgical causes, any pyloric stenosis, where child will present with excessive vomiting and fussiness, volvulus, strangulated hernia, and most importantly, testicular torsion. So these are the most important signs and symptoms which need to be ruled out. If by detailed history, there's 1/3 of the diagnosis could be in the history, 1/3 could be in the physical exam, and of course 1/3 may need lab investigations. Reassurance, if the child is stable, vital signs are stable, exam is normal, no hard signs on physical exam, parents are understanding, they feel reassured, you can discharge. If there's any concern that the child may be unwell, or any chance the child has lack of social support or possible neglect, a 24-hour observation. For more detailed observation and more detailed assessment may be needed. A close follow-up with their regular doctor or with you would be important in 24 hours if the child looks well, and a detailed discharge plan, that if the child worsens, has a seizure, fever greater than 100.4, no oral intake, no wet diaper in 8 hours, excessive breathing, increased work of breathing, vomiting, loose stools, becoming weak, lethargic, swelling of joints, rashes, the child should be seen immediately. And if you notice any signs of non-accidental trauma, please do not hesitate to admit the child and involve social services for detailed evaluation. I hope this video was useful in understanding the historical cues in excessive fussiness or excessive crying of the baby, the colicky baby, and has helped us to develop a plan for the proper management of excessive crying in the baby. Please like this video and share it if you can. I hope this video was useful in understanding about excessive crying and fussiness in the babies. Please take care of yourself and your families. Sallallahu alaihi wa alihi wa sahbihi wa sallimu taslima. Thank you.